I'm Jamie Eason, and I'm thrilled to have with me today top plastic surgeon, Dr. Michael Ciaravino. How are you?
Hi, Jamie.
Well,
Great.
I want to talk to you about a whole host of really sexy things, not sexy at all, that happen after you have a baby. You know, you have this beautiful child, but now you all of a sudden have these, like a ton of post-pregnancy new issues, if you will. So let's talk stretch marks, let's talk brown spots, there's body hair, there's so many different things. I mean, spider veins, you name it.
Right, all the joys of pregnancy.
Yeah. So where do you want to start? Help me out.
All right. Let's. Why don't we talk about stretch marks?
Okay.
Okay. And what are stretch marks? Stretch marks are basically changes that occur in the skin as a result of rapid expansion. So rapid weight gain or size change causes the skin to stretch, and we're seeing basically tears or thinning of the dermis.
Right.
Okay? Most common in the abdomen, the butt, the thighs, the breast. Okay? And typically what we see with this is areas of redness, early stretch marks, and then they go on to mature and lighten. Okay? We have some treatments available, but they're not total treatments. These are treatments mostly in the laser category that can kind of lighten some of the discoloration. Okay? Maybe we have some resurfacing that can soften the appearance of some of the stretch marks. So we have things that can improve it, but not fully eliminate it.
Right. Well, I know a lot of women, you know, wear them like a badge of honor, so they're okay with them.
Right.
But it is nice to know like what's available, and I know women will often ask me. I was really fortunate to avoid stretch marks, and I'm no spring chicken, so I don't know how that happened. But that leads me to the question: is it genetic? Is it partially diet? I did stay really hydrated, and I think I lubed up like with some sort of oil every day.
That's a great point. It does seem to have possibly a genetic component. It depends on the skin. The best thing that I could advise one to do as they're getting pregnant is stay very well hydrated, use a good moisturizer on the skin, and those are the two main things that we could do. Post-pregnancy, we usually advise just giving it time. Don't rush to have it treated because a lot of these will fade and lighten. If someone has a lot of stretch marks on the abdomen and it's in the area that would be treated with a tummy tuck, those can be removed. The higher stretch marks get moved down as we pull the skin. They tend to look better but may still be present.
Oh, well, that's great. That leads me to another issue when you're talking about tummy tucks. If you had a cesarean, a lot of women are experiencing keloids where it's hard and raised and it feels like a rope, and it's been well over a year and they still have that issue. Is there any option for that?
Right. When there is a raised hypertrophic or keloid scar, there's two main options that we have. One is injection of steroids can sometimes soften and lighten that. And the other is we surgically remove it. Because many instances, a plastic surgeon might be able to use plastic surgery techniques to get a finer incision there.
I imagine if they have a tummy tuck, though, you can probably cut, you know, in a way that
Very commonly, we're removing that and can improve on that. So there are some good options there for that C-section scar.
All right. Well, I'm going to jump right into the linea then, the linea nigra, the sexy brown line.
Right.
I had it at the end of my pregnancy, and afterwards I thought this is never going to go away. I scrubbed it with a loofah like it would get rid of it, and it didn't. But over time, it finally lightened.
Well, you hit it on the head there. This is something that the dark line of pregnancy occurs usually in response to hormonal changes. As estrogen and progesterone go up in the second trimester, that's when this line starts to develop. And it usually will go away on its own. There's actually no treatment recommended for it except for time and patience. Occasionally, if it doesn't go after a year, there are some skin bleaching creams that
Is that similar to melasma? Does that happen because of hormonal
Exactly
issues
right.
as well?
Melasma, discoloration that occurs on the face, brown spots, uneven spots, in response to hormonal changes. We've nicknamed this the mask of pregnancy.
Yeah, fortunately I didn't get the beard, but I have seen that.
Right,
I got little spots on my forehead.
Right.
So.
Now, melasma we do have better treatments for. And usually, again, we wait for some time, but we have options that include some lightening creams with a hydroquinone that can be used at home, and laser treatments like a profractional laser to try to resurface the skin and re-stimulate the pigment in a more even manner. So we have some good treatments for melasma, but the number one thing with this is to avoid sun exposure. Sun is a big no-no with melasma, and even after it's been treated, you think it's better, sun protection is essential because it can come back.
Yeah, I've seen that many times actually, where someone was treated and it looked beautiful, and then one time out in the sun, it was back to looking brown. But and another topic, of course, is spider veins. I've seen some women that have just tons of them in their legs, and they're young. Why does this happen?
Right, good question. Spider veins are often the result of changes that occur with pregnancy having to do with increased volume and pressure. So there's increased blood volume because the body needs to be supplying circulation to the fetus. And there's also pressure from gravity. So this tends to allow the pooling of blood toward the legs. There's also some weakening of the veins naturally that are occurring. Fortunately, we have good treatment for spider veins. Often post-pregnancy, they tend to improve as your body's going back to normal. And then we have options that include laser treatment, or sometimes we'll use sclerotherapy, which is an injection type. So there's a solution that's injected into the vein, and that can improve it as well. So we have some good options for spider veins.
Oh, well, that's good. There's hope then. One final question is about body hair. We start to lose our hair after pregnancy, and then you sprout some random hair in weird places.
As you point out, there's all kind of funky things going on with hair.
It's so unfair.
And pregnancy. There's a variety of different hair elimination methods. Laser hair removal has become our favorite, and it's very effective at treating unwanted hair. Usually requires a few sessions. We've been thrilled with the results. There's a variety of lasers out there to do it, and that's our preferred route.
Great. Well, so much great information. It sounds like we need to hide out for about a year and see how everything looks, reassess, and then we can come in and talk to you about the things that just aren't changing.
That's it. But as we know, you're not hiding out. You're working and diet and exercise and all of that.
I've been very fortunate. It's been an amazing thing, but this is my first. Hopefully, if we're blessed with a second, we'll see if I'm as lucky the second time around. But.
Well, you've done amazing, and you're an inspiration for so many, and I congratulate you on all your success and how fabulous you look post-pregnancy.
Oh gosh, thank you. Thank you guys for watching. If you'd like more information about anything that we've talked about or any other possible procedure, please check out thebodydoc.com.